So we're quickly trying to look at the next type of drugs which we'll be discussing, and this is the antihypertensive drugs, but we are focusing on the calcium channel blockers. So the antihypertensives, but is the ones that will block the calcium channel. So antihypertensive agents, the calcium blockers to be specific. So they are actually a major type of antihypertensive drugs. That's the ones that will block calcium. They are very important. So for them, they lower blood pressure by interfering with how calcium will enter into muscles. Do you understand? So normally when calcium is there, it will make the muscle to be contracting, but when you block this calcium from going in, you basically make that muscle to be relaxed. You understand? So what are the different examples? We have the dihydropyridine, we have the dihydropyridines. Okay, so drugs like the Amlodipine, Nifedipine, Felodipine. Okay, we have the non-dihydropyridines. So that's when the Verapamil comes in. Verapamil, we have the Diltiazem. Okay, that's when it comes in. So generally their mechanism of action is they actually block the L-type calcium channels in all those smooth muscles and also muscles of the heart. So because it will block it, there's no contraction, so there's reduced systemic resistance, and it will ultimately lead to reduce or lower blood pressure. So they basically decrease heart rate and contractility. So they are applied in hypertension, they are applied in angina pectoris, they are applied in arrhythmias, all these conditions that the heart is just beating abnormally. You apply these drugs in treating it. Their side effects include all those headache, flushing, ankle edema, reflex tachycardia, and the rest of it. Okay, so we got for calcium channel blockers.